Everyone, I'd like to call the Price County Health and Human Services Board meeting to order. I am Paula Hodak. I chair this board. And Meredith, would you please take the roll?
Thank you, Paula. Joe Baratka. Paula Hodak.
Here.
Robert Kopish. Patricia Stephen is excused. Dennis Warko. Peter Daly. Sally Hummel. Suzanne Acker. And Gerald Swenson is also excused.
All right. Thank you all for being here. We will go into public comment and communications. Is there any public comment? I say that with a little nervousness. Public comment from anyone out here? Hearing and seeing none. Anyone online? Do you see? *6 if you have a comment. Okay, seeing and hearing none, we will move on from that. Thank you. Vouchers, did they get around to everyone so far? You did, all right. So we would need a motion for approval. Mr. Kopish.
Second.
Mr. Brodka, second. Any questions? Any discussion? There you go. Microphone, please.
I had a whole list, so I emailed Chris Ann, so she got a heads up, and she answered all my questions. So I don't know if we want to go through this so everybody hears, or whatever you want to do. But I asked her about the payments to the state for family care, because there were 2 payments, and I was wondering if something changed, because generally it was 1 payment. But if you want to explain.
So there were 2 payments because one of them was for the rest of 2024. So that was the big $140,000 amount on the first report you saw. And then the rest was also paid on the same day, but it was a separate batch for 2025 for January and March. So it's split between the 2 years. So I had to do it in 2 different batches to separate it by the year.
So basically what we agreed to way back in 2014, it's still, nothing's changed.
Correct. Yeah, it used to be, we used to pay it semi-annually, $93,000 every 6 months, but now we just get 1 bill.
Yeah. Okay. Thank you. And then there was an office supply thing for the ADRC, and there was a screen vision for 1,500, a civic media for 2,940, and an office enterprise for 2,943. I asked what those were all about.
Yep. So that was all marketing funds for the ADRC. I talked to Dawn this morning, and we had gotten an allotment from the state, and it was used for equipment and a video to advertise the ADRC at the Phillips Theater. They have a video monitor up there that shows the services that the ADRC provides.
Nice.
So that was money in and money out.
Mhm.
Yeah. And then I saw Source Services, which seemed a different outfit, and I asked what their services were.
Right. So he's a Mike Turgeon. He's a consultant that comes down from Ashland, I believe, and he does behavioral health and children and youth consulting. He meets with staff and clients for both departments.
Okay. The next one was, there was a bill from Park Falls Plumbing and Heating for $1,540.
Yep. So that was a grant paid. It's called Putting Families First, and so that was just to install a water heater for a family in need in our children and youth department. So that was totally paid for by grants.
So was that a foster family or just a family?
Family that has children that are needing help, and
Okay.
I don't know the specifics
So
of it.
yeah, it's
but-
interesting to know that this stuff happens.
Mhm.
And then there's a monthly rent payment to the Ogama Library.
Yep.
And that's for senior meals.
Yep, the site rent.
And a light bulb went up in my head. Are we doing that for any of the other meal sites?
We pay First Presbyterian Church $200 a month for the site there. I think that's the only rent we pay.
Because there's another,
Oh, Kennan, yeah, we pay yearly.
well,
what,
there's another
$350?
site that the church is having financial issues. I don't know, should I bring something up?
Right.
Yeah,
Those
we
were-
got actually, we had a notice in our bulletin at the Catholic Church that they're looking for donations and stuff because they're struggling financially. So, which is kind of a surprise. I thought they were doing very well, but they're not. Now this is a public meeting, so you're probably going to get a call tomorrow, but Interesting. If we're doing all those other sites, would it make sense that we do all the sites?
The other sites came forward and said, we do, like the Presbyterian Church, when we signed up there, it was, we have somebody that does the bathroom cleaning, all these services. This is what we would like. So it's really up to the site to
Okay.
prompt us.
Okay.
Garbage too.
Yeah, garbage takeout.
We send out memorandums of understanding at the beginning or in the fall of every year.
To all of them?
Yep, to negotiate the site. What
So
we're
if,
gonna do.
if they want something, they should come forward, basically.
And Ogama is the one that just went up.
That's how they increase.
Mhm.
Yeah.
Yeah.
Okay.
And
Okay.
we've helped Park Fall, like, did we get a refrigerator up there? A couple, yeah. So we were also working with them. So they might not get the $100 a month, but they needed a refrigerator. So we purchased the refrigerator because we use it for the meal
Yeah.
site. So there's different ways we pay the sites based on what they request.
Right.
So
Okay. Okay. Just that. Okay. And then there was 17,691 for a forward home for boys payment, which I thought, holy moly, that's a lot of money.
Yep. So it's a group home in Richland Center for one of our children down
Is,
there.
is
So-
that for a month or
Mhm,
3?
yeah.
That's
So
one
it's
month.
300, 500 some a day. I forget how much.
$17,981, $691 for 1 month.
Yep.
A lot of money.
Hopefully he won't be there long.
Yeah, that's a lot of money. Okay. Thank you, Chrisanne.
You're welcome.
Any other questions for Chrisanne? Okay, so I will call for the vote on the approval, the motion. All those in favor? All those in favor? I heard I. Those opposed? The motion's carried. And also your minutes from March 12th meeting. What is your pleasure? Motion with Mr. Wartko, second from Mr. Kopesh. Any comments and discussion? Hearing and seeing none. All those in favor? Those opposed? Okay, that carries. Public Health Unit, Tiffany Palachek. Hi, Tiffany. Okay,
Good morning.
good morning.
I'm presenting our quarterly report for public health for January to March 2025. I believe that was in your packet ahead of time, so you probably had a chance to kind of look it over. Just going to go over a few of the highlights. Immunization wise, on the last page, you can kind of see our usage there. It did decrease from that last quarter of 2024, which is pretty normal for us because we go from giving a lot of flu and COVID vaccines in the fall to kind of just giving routine maintenance vaccines heading into that following year. We did receive through the state some children's books that we can provide. They're actually very nice books. They talk about vaccines. So for maybe those that are a little bit hesitant or have questions on vaccines, they're useful educational pieces that we can provide to families and that they can even talk to their own children about. So we did receive those and we're hoping to get those out to our families here. Communicable disease wise, not too much of a change there other than we did see a big decrease in our pertussis cases going into 2025, but we did see some increase in hospital influenza. As of now, this was some, first quarter, so everything's kind of lessened. So communicable disease wise, we're not seeing as much with the respiratory anymore. So looking ahead into some of our programs, into the maternal child health check, we did a few more. WIC is staying pretty much about the same. And we did see an increase in our PNCC and targeted case management families. Morgan, our newer nurse, she is doing an excellent job on outreach to our community or our clinics in the area, letting them know about our prenatal care coordination program. So we're helping out with some higher risk pregnant moms, getting them resources that they need, providing them that education. So she's doing a phenomenal job with that. So that's something I think she should be proud of and that we're proud of her for. So and reproductive health, we're seeing about the same. Environmental pretty much looking the same as we had for environmental calls. Nothing's really been too crazy there. We are doing some follow-up on a few cases. And radon, we've had a couple test kits come back. Two of them had higher results, and Amanda McMeekin is working with those individuals. Dog bites were up, and I'm sure we're going to be seeing that as we go into the next couple months as well with that. We had 6 dog bites, 3 cat, and then 1 parent rat bite this in that quarter. Preparedness wise, we continue to do our safety education. Michaela's been our lead on that and doing a wonderful job there. She attended the governor's conference and got quite a bit of education that she brought back to our unit. Going forward, she is using that, and she's updating a lot of our preparedness plans. So we are ready to go for any outbreak or any emergency thing that comes up. So, and then looking at our coalition, the credit there goes to Susie and to Jojo, who are here with us today. They are doing a phenomenal job with our, which was our AODA Mental Health Coalition. The name of that has changed to be a little bit more trauma informed. It is now a Substance Use and Mental Health Coalition. You could see there's some of the products that they were able to provide through their doTERRA bags and their lock boxes. And then Jojo had the opportunity to attend the Phillips Sport and Home Show to provide some education and resources. That event had a lot of individuals on that Saturday, so a lot of information got out there. A few less on the Sunday part of it, but there was that snowstorm that came through. But I think overall, we, from talking to Jojo, she was able to talk to a lot of individuals, get education out, resources out, and then got some really good feedback. Even community members being thankful that, you know, Coalition is doing their job on educating the school districts and community members. So that's always good to hear. Along with that, Jojo and Morgan were able to go to the Phillips After School program. They were asked to kind of help do some educational pieces there. Some of that started in March and then went into April. So I'll be talking a little bit about this again the next time when we do the next quarter report. But they were doing more harm reduction strategies like bike helmets, stranger danger, healthy choices, and introducing that concept of healthy choices and decision making. So the kids were engaged. They had a lot of discussion, and I really do think that the nurses enjoyed it too, getting to be right there with the kids. So, and then going back to the Health and Wellness Coalition, I missed that. They continue to kind of monitor to see how those hydroponic gardens that they established some time ago, how those are doing. And it looks like those are going pretty well too. And then just overall agency wise, we're continuing to do our public health update, which I hope that you are all receiving, and doing our education and resources through our Facebook outreach as we can. So any questions?
Okay, I don't see any.
Okay, thank you.
Thank you. Pardon me? Sure, if you would. Go ahead. Thank you, Tiffany.
Today we have the opportunity to have 2 of our coalition individuals here, Jojo Baraka and Susie Daniels, and they'll be providing a presentation on THC is changing. So I will ask them to come up and do their thing. Thank you.
All right. We'll wait for the PowerPoint to kind of pop up and then, but in the meantime, so like Tiffany said, my name is Jojo Baraka. I am a Price County Public Health nurse. I also am the co-chair of the Substance Use and Mental Health Coalition for Price County as well. So we were asked to come here today just to kind of talk about how THC can impact the public's health and what we're kind of seeing within Price County. You can go to the next slide, please. So before I kind of dive deeper into kind of what we're seeing within Price County. I think it's a good starting point to understand what the difference between what we're knowing as Delta 8 THC stuff, Delta 10, and then the Delta 9. So these all originate, whether it's from marijuana plant or the hemp plant. Often people associate that with CBD. So both of these plants actually come from a parent plant called Cannabis sativa. So that's like the umbrella term of it. And then you have two different aspects of it where it results in the hemp plant or the marijuana plant. So going to the far left, that's going to have the hemp plant. So this one is going to have a lot of that CBD factor into the plant, and then there's going to be very little THC that's seen within the plant. So how this kind of goes about is there's two different types of seeds that come from this plant. So you have a male and a female seed, so that's how you get more of that CBD factor. With the CBD, this is going to be more or less than the 0.3% of that THC. Going to the middle picture, this is going to be the marijuana plant. This is where Delta 9 is going to be naturally occurring. So as you can tell, the THC portion is very high, where the CBD portion is lower. This is going to be the 0.3% or higher. So in the state of Wisconsin, marijuana, anything that has the THC above that 0.3% is going to be illegal. And then the 0.3% or lower CBD hemp is going to be legalized. For people that like chemistry, this picture on the right is going to kind of show how the chemical structure differs, and then that determines the compounds, the potency of what the product could have. So one thing to kind of simplify this even further, everyone knows that there's multiple peppers within the pepper family. So you have bell peppers, jalapeno peppers. So bell peppers are going to be more similar to like a hemp plant, where jalapeno peppers are going to be similar to marijuana. So as you can tell, there's varying potency with the spice level within peppers. So if you think of a bell pepper, that's not going to have a lot of spice in it. So it's going to be similar to that hemp, where there's a lot more CBD, so less of that potency. Where marijuana is going to symbolize the jalapeno, so there's going to be a higher potency of spice or THC in it. The one caveat to this too is to understand, specifically in a public health standpoint, is everybody's body is different. So whether one person's going to think that hemp is fine for them, like doesn't affect them whatsoever, the next person could have a lot of side effects. And that's the same thing with the marijuana plant as well. So really truly understanding that everybody's body is different. They metabolize everything different, and it affects them differently. All right, you can go to the next slide, please. So I talk a lot about THC, but I think it's good to understand what that actually stands for. So THC actually stands for tetrahydrocannabinol, which is essentially just a science term that creates the psychoactive high that you see with specifically the marijuana plant, since it has an overabundance in there. So this is what you're going to see the high-like symptoms for. Like I said, Delta 9 is going to be naturally occurring in both of the plants, just a lot more within the marijuana plant. So that's why Delta 9 is not legalized within the state of Wisconsin, because it has that greater threshold above that 0.3%. So this is what is specifically causing that high that is associated with marijuana. The novel or new emerging THC, so this is going to be the stuff that has to get synthesized from the hemp plant. So these are hemp-derived products. This is going to be our Delta 8, Delta 10 products. So it's not naturally occurring, so they have to synthesize. Companies or individuals have to put additives into the products to make them what they are. And once it's synthesized, it gives a similar psychoactive high that natural THC does cause. So since it's hemp derived, it still is underneath that 0.3% of that threshold. So in 2018, the Farm Bill was put into effect. So that's where the loophole comes in for these Delta 8, Delta 10 products, because they still fall underneath that threshold, but they still can have similar side effects and highs that Delta 9 can have. Some of the other products that Delta can be in a form of. So a lot of times we think of the edibles. So we have the gummies, baked goods. Now they're coming out with drinks, lollipops, anything really under the sun. The other one is vaping. So a lot of times we think of vapes containing nicotine, stuff like that, but they can also have THC within them as well. The last one is concentrate. So this is going to be our waxes or shatter, which shatter is actually listed or put on the picture on the bottom right. So honey-like substance, but once it's vaporized and heated up, it creates that vapor. So then they inhale it and get that high. All right, we can go to the next, please. So looking at novel THC again, like I said, it's going to be those Delta 8, Delta 10s, and then there are other subcategories, but what we're typically seeing is that Delta 8, Delta 10. Like I said, it's going to create that marijuana-like high, but it's still underneath that 0.3%. Okay, you can go to the next, please. Again, if you like chemistry, this is a good kind of representation of that. So looking at really the chemical structure of these, wherever a double bond is on the structure, you can see it with a circle. That's really what kind of gears the potency and the effects that could potentially be had. So the middle picture is that Delta 9 naturally occurring. So there's that aspect. And then once it gets synthesized, you can see how those double bonds change and the way they get their names, Delta 8, Delta 10. It's just where that bond is doubled within that. Okay, you can go to the next, please. I just wanted to throw this in there just to kind of get familiar with some other names that could potentially be had for these products. Oftentimes D8, it's very kind of incognito. Not really many people are going to truly understand what that means, stuff like that. So I just thought it would be good to kind of see. And the next slide is going to kind of talk about public health. We always ask why. Why are we seeing these changes? Why are we seeing more kids wanting to do these products specifically, and even adults as well? So looking at this, typically when you're using THC products, the goal, you want to get that high, you want to feel relaxed. It might be something new, specifically for youth. They are very curious individuals. So trying something new, wanting to fit in. They think that they're going to be having fun, stuff like that. So that's one aspect. And then the other aspect we look at is mental health side of things. So are they using these products to cope with challenges in life? They might not like side effects that they might have with some medications. So it's kind of, in a way, putting a Band-Aid on a big open wound. They're suppressing the feelings for only so long, and then it's still gonna be there at the end of the day. You can go to the next one, please. So all of you guys have this handout with you. So I'll let you kind of read it on your own time, but I'm just gonna do a quick hit on certain aspects of it. So it lays out each of the deltas that I have talked about, and then I also put CBD in there just for, and then there's an understanding of that as well. So looking at the Delta 8, like I said, it's going to be underneath that 0.3% still, but you are still going to have a mild high, feeling relaxed. For adverse effects, you might get loss of consciousness, irregular breathing, increased heart rate. The bottom part of this, the long-term effects, I'm just going to skip until we get through all the Delta products because they're all the same. So Delta 9, that's going to be the naturally occurring one. So it's going to be the highest of the Delta products for high. You might get euphoric feelings, deep relaxation. Adverse effects, extreme hallucinations, dissociated thoughts. So these are going to be thoughts that you're going to feel out of body, not in tune with the world. for Delta 10, these are going to have the effect of boosting a mood, energy, uplifting. Adverse effects, poor short-term memory. You might have some headaches as well. Looking at long-term effects, so this is going to be the high-risk stroke and heart disease. So going back to the increase in heart rate. So our body is not designed to have an increased heart rate for a very long time. So the consumption of these products could cause heart disease in the future and potential for stroke. Looking at damaging of the lungs, this is going to be more so for inhaling these substances. So whether it's a vape or a joint in a case. It's looking at or scarring the lungs, so it's going to decrease the oxygenation throughout the body. Mental health illnesses, a lot of times, like I said, they're used for coping, but it's not going to last. It's just a Band-Aid. So a lot of times increased mental health illnesses are going to happen as well. And then with the youth specifically, changes in the brains, how the brain works. So we'll get into that one a little later in the presentation as well, but just wanted to hit on that. And then for CBD, it does not produce a high because of how much CBD is within the product. And then also there's a very little bit of THC. Okay, and then this next one is just, again, kind of going through all of these. The one that I didn't touch base on is a weakened immune system. So as everyone knows, we did the community needs assessment, CHIP plan. So one thing that is always kind of a reoccurring thing is chronic disease within Price County. So if we're looking at how these products are potentially weakening the immune system, it's going to create our body more susceptible to different diseases and different chronic diseases. So if we're trying as a public health for Price County, trying to minimize those chronic diseases, this isn't necessarily going to align with that. So looking at consumption of THC, like I said, there's going to be different ways that you can consume these products, whether it's smoking or mixing it with food and edibles. The big caveat to this too is that a lot of times THC products aren't very known and educated on. So a lot of times people are overindulging in the edible portion of it because, as you can see, it takes 30 minutes to 2 hours to reach some type of effect. It's not even going to get to the highest of the product. So if people aren't seeing a result just like that, they're going to overconsume, and then there's a risk of overdosing. A lot of times we think of overdose as applying to opioids, but there is overdoses with just overconsuming stuff, and then you get the adverse side effects that you're not wanting. You guys also have this handout as well. So this is just kind of looking more towards inhaling versus ingesting. So inhaling is going to be a lot quicker of receiving those effects than ingesting, just because of the metabolization process. So looking at the left-hand side, it's going to take seconds to minutes to start feeling some type of effect. To reach a full effect, it's going to be within 30 minutes, and then it can last up to 6 hours, residual up to 24. Looking at ingesting, like I said, ingesting stuff, it's going to take a lot longer because there's a lot more different body systems that have to metabolize the substance and then create that high. So 30 minutes to 2 hours, like I said. Reaching full peak is up to 4 hours, and then it can last up to 12 hours, and then residuals are 24. So kind of getting that basis down, we like to understand, like, what are these retailers doing to these products to make them so effective with selling points and wanting people to purchase these products. So as you can see on the screen, they make them very eye appealing. They have funny names. They're very similar to favorite snack foods. So youth specifically, they're going to see that something looks very similar to a Sour Patch Kid or Doritos. And why wouldn't they want to try something like that? Because it's most likely going to taste the same. With this as well, they are very easily accessible online. So with the next slide, it's going to show kind of a comparison between these two products. So I was able to take the picture on the left from one of those websites, just a picture of it, just to see what a packaging would look like. So as you can tell, even with that picture on the left, it looks very similar to a Nerd Gummy cluster. Within the package, what I was reading, so this is for Delta 8 gummies in specific, there's roughly 10 of those gummy clusters that are in that pack, reaching 250 milligrams of THC within the product. So this package does do its service of giving a direction. They're only supposed to take one gummy, and then they're supposed to wait between 1 to 3 hours to take another one. So they're doing very well in that aspect, but if you look at it as a public health kind of standpoint, if these products are within the home, at school, I don't know how many kids would turn down something that looks like a candy gummy cluster. And then in that same aspect, if we're talking about overdose situations with overindulging, I don't know how many people would just eat one gummy cluster. So chances are there's a potential for receiving 250 milligrams of a THC product just because there's a lack of knowledge of how to use the products. The next slide is going to kind of show what we're seeing within Price County. So there's a few data points that I'll get to in a second, but looking at Price County, we're seeing a lot more mental health concerns, whether it's anxiety, depression. We see this specifically with the youth as well through the YRBS survey. So that's the Youth Risk Behavior Survey. So looking at how the typical teenage brain is, the larger highlighted part is the prefrontal cortex. So this is going to be our thinking, reasoning, logic side. This is not fully developed until roughly mid-20s at that. So high school, it's not fully developed. The smaller highlight is the amygdala. So this is going to be responsible for how we portray our emotions. So the next picture is going to kind of show what could happen with a youth consuming THC products. So if we're looking at this as an academic standpoint, these students are going to potentially use THC before, during school, and if they do, these are kind of the adverse effects that could happen. So if we're thinking academic wise and they're in class, they're not going to be able to absorb all the information that the teachers are teaching with the impaired memory, poor decision making. So they might not be doing their homework, skipping class, stuff like that. As for the athlete side of things, there's a decrease in coordination, and same with the motivation as well. So these athletes are not going to be reaching their fullest potential with the sports that they could be doing. The last picture on this screen as well is going to show kind of different effects that THC, cannabis can do to youth mental health. So like I said, it's going to increase those depression, anxiety symptoms. It's basically just a Band-Aid. It's not an effective coping mechanism for those youth. Lastly is going to show what our youth or juvenile data says about Price County. So you guys all have this handout as well. This is going through 2023 to 2025. The 2023 data is going to be for the YRBS survey that I will talk about later. So I had asked the City of Phillips, City of Park Falls, and then Price County Sheriff's Office to give me some data on what they are seeing with the youth, their citing, and if there was THC products at the point of citation. So as you can see for the City of Phillips, they had 9 total youth citations. Of those 9, 2 of them had THC products with them. The City of Park Falls had 5 total youth citations, and of those 5, all 5 of them had THC products. And then for Price County, they only had 1 citation that was provided, and that one did have THC within it. So kind of going back to the city of Phillips, this was done from January 2025 to March of 2025. City of Park Falls did not have any citations through 2025 this year. So this data is actually from May 2024 to December of 2024. And then the Price County one is from this year as well. So kind of taking a deeper dive into that, you can see on the bottom what products were confiscated and cited during this time. Looking at the YRBS survey, as you can tell on the left, it's not really looking like a lot of our youth are being caught with this stuff. So it looks like it's probably not happening. But once we look at the YRBS data, you can get a better depiction of what our youth are engaging in and what they're thinking. So unfortunately, this data is a little bit on the lower side just because one of our school districts did opt out of the survey. So we're anticipating that these numbers would be higher just because we don't have the full county. Of the surveys that we could use, 328 of them were utilized. And as you can see on the data points, just under a quarter of the survey results, 24% of those students had said that they had ever used marijuana products. 14% of them currently use these products. And then before the age of 13, 26% of them had tried products. So looking at these data points, there's discrepancy within the citations and the YRBS. That could be because these youth are using it at home, and a lot of these products are very disguisable. Like you said or saw, they can look like candy, they can look like drinks, they can move them into different products. The big thing also with this youth survey is the mental health aspect of things. So like I said, a lot of times coping mechanisms, they use these products. So if we're looking at our youth, 36% of them have said that they had some type of mental health concern. So for a public health and a coalition standpoint, we're looking at, of these 36% of the students, how many of them are actually engaging in THC products, marijuana products? So that's something that we have to dive further into to truly understand like what is happening within our youth. Kind of going into that, the last kind of talking point, we talk a lot about youth because they are the future of Price County. Specifically. So that's why I wanted to touch a lot on this. There are different aspects of public health. So we have adults and we have just the community in general. So looking at how THC and marijuana products can affect our health, we're looking at the community safety with if these products are being used while someone is driving, it's going to impair their driving skills. So looking at the safety aspect of that and just really knowing that a lot of this education is not being done right now. And there needs to be more of it just to get a true understanding of what these products can do and how to, if you're potentially going to use them, how you can do it safely. So, yeah.
Very nice. Thank you.
Thank you.
Any questions for Jojo?
Madam Chair, may I ask?
Yes, please.
Thank you. See, I was just wondering, okay, right now in law enforcement, the last couple meetings, it's been on the agenda to legalize, I believe, I want to get it straight. They're looking for Delta 8 and Delta 10, which is currently illegal in Price County and the city of Phillips. But in the state, it is legal.
Yeah, so how I understand it is the state can set their guidance with these products. So since it falls underneath that 0.3%, it is considered more of that hemp derived product. So the state of Wisconsin did legalize that. However, county ordinances can be more specific. So it just depends on what the county would decide.
So on the law enforcement committee agenda, when they bring it up or have it on the agenda, they're asking for the county to legalize 8 and 10. Is that what, do I have the right understanding?
I do not know that.
Because it's been on the agenda a couple times and we're waiting for you guys to come give a
Right,
presentation.
right now with our current ordinance, it says you cannot possess 8 or 10. To change the ordinance, what's been talked about in law enforcement is putting potentially an age. So like alcohol after 21, you'd be able to access or legally possess Delta 8 or Delta 10. You could also just reverse the whole ordinance and allow anybody. So then that would be that's where it originated from, as we were having problems with the schools. You saw, what is it, Phillips had 9 or 8 or whatever it was. And so that's where this originally came from, is in order to stop the possession of the Delta 8s and 10s in the school, there needed to be something in place. So what was passed was all of the Delta products in Price County are illegal to possess. What's been discussed in the last couple meetings is, do we review that and say, treat it more like alcohol, so 21 and older, because the state allows the possession of 8 and 10, or do you reverse it all and not deal with it? But that's
That's a
so
discussion for-
legalizing, it's the wrong word, because it is legal. It would be,
Well,
the possession would be
in the county.
legal again in Price County.
And the details of allowing it or allowing possession of it in Price County need to be worked out law enforcement. I think if it gets on the agenda again, I just wanted to be clear, in my mind at least, what they're asking for and where we stand, and what's your opinion on it, if you care to give one.
Walking away.
We won't speak to an opinion on it because I think it can be interpreted many ways, but we can provide that education so that those in the decision-making power they have that education, they have that awareness so that they feel informed. You have the ability to talk to your constituents as well.
Sure.
And find out what they need. What we did is we did our community needs assessment, and JoJo highlighted on that very nicely.
Very good,
If you look back at the community needs assessment and the community our plan, you'll see of those that we surveyed what their feelings were just in general of substance abuse, marijuana use. You could see by the behavioral use survey how it's being used by kids. We can provide that education to you. We could provide that education to the family, but we can't tell you. We will respect the decision that is made, and we will continue to support how our community's health and safety as we can.
To clarify, it's not THC the law enforcement's working with Delta 8, Delta 10. I know a lot of this presentation was focused on THC, which it's a product of based on science stuff, but just that, I think that's where even the committee, the board, a lot of people are struggling with. There is separate products that the ordinances need education on.
Joe?
Can I give one more question? Then I'll be done.
Go ahead. Sure.
Has law enforcement committee chair contacted your department at all regarding putting this presentation or something similar on for that committee meeting?
We were in collaboration only for the stats that you saw on that page. And they may be part of the coalition. Law enforcement may be a part of the coalition, but there was no
I think you're asking it.
direct.
Did the sheriff or any of us ask you to do the presentation at law enforcement?
Basically, yeah,
Yeah.
or the committee chair.
Oh,
Because Larry probably didn't.
Because
reach out to
they
you.
keep, I don't know, if tabling's the right word, but putting it off, let's put it that way, at the meeting because they want to hear from Health and Human Services regarding this.
Mr. Brodka?
So, to that point of it, to my understanding, and Bob can jump in here too, but there was a request at law enforcement to get more information on the Delta 8 and how it differs from THC, and you guys did an excellent job
Yeah.
on providing that. Gave me the information that I needed to know how those products are differed. And also with that, through law enforcement, it was recommended that that be presented at this meeting and not the law enforcement meeting, and then from there be taken back up by law enforcement. And I would say anybody on law enforcement that needs this information can go back and watch this presentation because this was very helpful.
Very helpful. Mhm. Any other questions? questions?
Paul, just to further what
Mr.
Joe said, I
Kopish.
think most of this committee is on law enforcement. Yeah. So I think Patty might even be on.
Yep, I
Yeah,
think she
so I
is.
think
Mhm.
4 of us are, so she hasn't seen it. But when this issue was brought up last year, before we did the ordinance, I think the major issue to me is when the sheriff said when they test, they can detect the Delta 8, 9, or 10, but they can't differentiate. So 9 is what they're looking for because that is greater than the 0.3%, but they can't tell when they test what it is. So they stop somebody, they test. How do you do anything because you don't know which one it is? And to me, that was a significant factor. That's why I advocated for just doing all of them. If you test positive, the sheriff can issue a citation or whatever they do. Since then, this information on the amount of this material that's getting into the youth through all this different packaging and everything, I think is significant. I think the earlier our children get exposed to this, the more problems there are going to be later in life. And I don't think we want that. And somewhere we gotta stop this from happening. And if we can do that through our ordinance process, then that's where my head is at. I don't like to see this. And kids are going to eat candy, they're going to do stuff. They're not going to be paying attention to all this stuff and where they get it from. Just what's in our schools. I know a school board member in Park Falls, and we were talking about the amount of vaping and stuff going on. Well, we don't have that here. We don't have that in our school district. And then they watched the Hidden in Plain Sight. They saw that and they said, "Oh my gosh, I don't believe it." And then you realize, yeah, it's all over the place. So to me, from a public health standpoint, this is a prevention issue as much as anything else, legal, illegal, whatever. But I think we need to do something. So that's where I'm at, just to let you know.
Mr. Ernst?
I would agree with Mr. Kopish, but I think we need to, if it gets on the law enforcement agenda again, we need to hopefully have all the facts and let's put it to bed one way or the other.
Right, I agree.
And I will talk to the committee chair about
Okay.
that, but
I agree.
Sorry, I'm right on top of this right now, and Bob, and through our other Partnership for Success grant, just Monday, I sat with our youth at Shawamigan. I had 10 students doing a focus group, and just threw up a piece of paper, had them writing on notepads. My question was, why do you guys do these things? Alcohol, THC, vaping. All of those answers that came up onto my big pad, we needed to cope, we needed to withdraw, we needed to feel better about what's going on. So the mental health concept, as you mentioned, is a big underlier in this. And I think if we can maybe work on some of those issues, giving our kids some other type of supports in school, whether that be the training for resiliency or the support that Sarah's group gets or the support of counselors in the school, all which are going on, but we have to show our support for all that. I think we might see some improvement.
And to that, I know we saw, Sarah and I earlier, Tiffany brought over with Bob and I, we were having a little discussion, and she brought those graphics about the gummies and those, it was just blew my mind. That was like, so I anywhere I travel, if we stop at a gas station or anything, I'm checking those packages, just because I just don't think that information is out there enough. And I don't think parents, we can't blame the parents because the packaging looks the same. I don't know how they can do that in marketing. I can't do that in songs. If I want to sing somebody's song, I have to pay for a royalty. So, I just think we just need to keep crowing about it and getting it out there because it is scary. A child can pick up a bag of gummies and consume the whole thing without even giving it a thought. And then what's going to happen? So thank you. Nice presentation.
Thank you.
Mr. Kopish, did you have
No,
something?
no, I was saying, yeah, I agree. Nice presentation. Thank you very much. And I think we were supposed to get this presentation at law enforcement.
Yeah, that was,
I thought that was the reason why we didn't have a meeting this month. We would have had it, but we wanted it to be at Health Human Services first
Right.
and then go to law enforcement. That's why the meeting
My
was
understanding.
postponed
Right.
from, yeah.
And our meeting was canceled last month,
Yeah.
so it lost that.
Yeah.
Mr. Warco, you had your hand up?
Well, I just wanted to tell you that I disagree with a lot of the things that you and Bob are saying, because I
Okay.
do not believe prohibition works. And you know, you're talking, you know, I'm sure there's more of it going on that they're not getting caught, but the ones that got caught, you're talking about a couple dozen youths. So the answer is to take it away from all the adults in Price County because of a couple dozen youth.
Good point.
That's
Okay.
my point.
All right. All right.
I know we're on the opposite end of
That's
this
okay.
issue, but-
That's why there's a,
You can't understand that? Well, that's because you're too far.
all right, we're going to move on, gentlemen. You can take it to the lunchroom or something, so.
not outside.
Out, yeah, to the lunchroom, right? All right. Well, thank you for that presentation. That was very good, always informative. Thank you. Next is the Waldab Board of Health Forum. When Michelle was still our health officer, she approached me to be on the Waldab Board of Health as a northern representative, wondered if I was interested. It was kind of a busy time. I said, I'd be kind of interested, so kind of keep my name there, but I'm not really ready to jump into that. Well, I received an invitation to the Waldab Board of Health Forum. So Waldab is the Wisconsin Association of Local Health Departments and Boards. And it was a 6 o'clock in the evening Zoom and virtual meeting. So I thought, well, why not? I'll go online. Unfortunately, because it was 6 o'clock in the evening and it was a gorgeous evening, there were a lot of people who had signed up who didn't show. So the organizers were a little disappointed, but they didn't throw us all out. So we were able to discuss. So who was there were board members from Ashland County, St. Croix County, Winnebago, Iowa County, myself from Price, and then two I couldn't catch where they were from. So we had, they were health officers, directors, and then Andrew Booth, Hoyer Booth was the executive director, and then Tara Drager was the assistant director. The whole idea was to start working on advocacy versus lobbying as board members, and how we're going to help out and what we do. And that was the whole, it in a nutshell. There's a huge amount of discussion that went on. One of the questions, I'm going to use my phone because I kept taking screenshots of things that were important to discuss. They wanted to meet with other Board of Health members from across the U.S. and hear how they're compromising and facing these challenges, engaging in discussion and brainstorming how we can better support Board of Health members. It was very, very interesting. And then at the very end, I mean, there was a lot of discussion, and I won't take up that time, but I found it enlightening. I found it as something I think I will be on there, because I don't have a problem being vocal about something I really and truly believe in. And I believe in our Health and Human Services staff and all that you do and all the work that you do for all of our county people. So they asked any of us that what does our county do to support Health and Human Services? And boy, I went off on that one. I mean, I talked about how you help in the schools, and you just mentioned it about the after-school program. And I remembered, and I talked about when I was a teacher and how we knew if there was an issue that we couldn't talk about it, but we would have to call the health department or the human services, and they'd have to come over and discuss it. And sometimes we as teachers, we had no idea what was going on because we had no right to know what was going on, but we knew that issues were being taken care of. And that was comforting to us as teachers in the classroom, that students who had issues were being helped. We talked about public events. Boy, I could brag about how much of our our departments do for our county, all kinds of events. I can't believe what's on TV already and what's on the billboards. And now you're going to put an ad at the theater, which I thought, oh, that's a cool idea, you know. Went on to brag about that. Presentations at our dining sites, but they thought that was kind of cool. And then I talked about how we as the county committee, and then the county board as well, have presentations from our Health and Human Services Board. I couldn't believe how many were blown away by that. You mean they come and talk to you? I said, oh, definitely. I mean, we invite them in there. Well, I'll tell you, this Doug from Winnebago County asked if I was going to move to Winnebago. So I said, no, I'm going to stay in Price County. I like it here. So anyway, it was very informative. I was very green into what they were going to be discussing, so I'm now ready to do that. So I just talked with Tiffany. She's on the board, and she was telling me about how she now is going through some extensive training on all the different statutes, and that's put on by WALDAB. So if you hear that word, you're going to know what that has to do with. So there, I just wanted to give you just a little flavor of what happened. But 6 o'clock on a beautiful night is not a good time to bring in your Health and Human Services Board and county board members. All right. Let's move to the vital strategies, opioid settlement fund matching request for proposals. I did receive that. Actually, it came up on our Monday morning update meetings that we have for the county with WCA. So I did have Meredith put all that information. It was not light reading, but it was in there. So I'm going to pass it over to Nick because he has more about that. He is the one who said, I think this is a good idea to bring it to this board. So go for it, Nick.
Yeah, and we got it from a couple different areas. WCA, some of the board members forwarded this on. So it's just a thing to bring forward if something pops up of a strategy to work on opioid issues. Programming. The biggest hurdle with this program is day one, it's 1-for-1. They'll give you matching funds. It's year two. So you put in place a program that costs $100,000 and you get, $200,000 program, it costs you $100,000. The next year you have to come up with the additional $100,000. So it's a 1-year match, and it's not one-time funds. It's not like, oh, I can buy a bunch of test kits, or I can do something with, education, or, more ads, things like that. You have to put a program like a recovery program, a housing program, something that would help with opioid addictions, and then maintain it. So it's a really difficult thing for our size county to do that. It is nice, right? If we were planning, I know counties that are using this they're getting much bigger settlements with the opioid fundings, where we're getting, $15,000 to $20,000 a year if we're lucky through the opioid settlements, where some counties are getting $900,000, $800,000 a year for the next 20 years. Well, they can start a recovery house or something, and then they can go, cool, to get the house up and running, I'm going to get a dollar for dollar matching fund. And then the next year, I don't need to worry about that because I have other funds to do it. So I don't know of any programming. I've, talking to Sarah and talking to the health department, the sheriff's department, where's the programming that would fit? There's plenty of programming we could do. It's how do we do it long term? So that's where this comes from. We wanted to make it aware. Do you want us to look into it further? Do you want Tiff and her department to look into it? Sarah, anything?
I work closely, Nick, with the county you're talking about, and I guess I'm not excited what. I have found that they have been very successful, especially in Lincoln County, Ashland County, Iron County, Hayfield County. And it's funds that go toward the things that we were talking about, support prevention programs, are what a lot of the counties are using. Bear County, yeah. Sheriff sat next to me last week and said, I've got $1 million sitting. Yes, he does. And what he's going to do is call for the law enforcement. Again, I'm looking at public health. $1 of prevention is going to save you $7 in the end.
Yeah.
So I'm thinking,
and I'm not arguing about the the opioid money. I'm talking just this additional money. Like the opioid money, we have not allocated to anybody. That still needs, you technically have to have a committee, you have to allocate it. That should be used for what you're talking about. That's not the argument. The argument is this is an additional above and beyond that money. That's a one-time money. So that, I agree. We have not done anything with our opioid funds yet. And I can't remember, Carrie told us the other day the amount it's $80,000 or something. We're sitting on waiting to, we should be getting a committee together. We should be starting to work on programming. But this is a different program above and beyond that, or outside of that scope.
Any other comments? Any other comments here? We're trying to find when it was due. I thought it was June 30th, I think, or something like that.
Madam Chair, can I ask a question?
Sure.
So if I understood, Nick, if, let's say we're getting 20 a year.
Yeah.
And if we did this, we'd get another 20.
No, these are one-time startup funds for a program
Okay, but would we get another, well, how much would we get?
up to $100,000.
But we have to have the 100 to start with.
Yeah. So you have to have matching funds to start a program.
Right.
Yeah.
And then once you get the matching funds, then you got to stay at the total level going forward. So this gets to be a budgeting
Correct.
issue.
That's where again, we need to be using our opioid money for opioid stuff. This is a enhancer that causes a budgetary issue.
So I think this
But
gets
for
to
not
be,
the $1 million.
I think this gets to be a department and administrator issue as far as the budget for it. I mean, we can't commit ourselves to something that we may not be able to live up to
Right.
going forward because of budget issues.
We still, and Sarah and I have talked about this, we still need to get together the opioid. It's not a task force. It's something where, so in order to distribute the opioid funds, we've continued to claim zero. We haven't done anything with it. We're building up our fund balance of the opioid money. It started what, 200, you have to have an ad hoc committee, Carrie just said, under the rules. So we need to get together a law enforcement, a community member, health department member. There's like a group of individuals to say, how can we best serve the community with this opioid funding? This is outside, above and beyond that issue. Now, if we had something going, maybe you could use a little bit of this to get it up and running. But the problem is, like you said, if you said, oh, we're going to do a $40,000 program, we need 20 of this, 20 of that. Next year, we're only getting 20, but we have to commit 40. Now we have a $20,000 budgetary issue. So I'm not saying, yeah. So opioid money, we have to get an ad hoc committee together, get something going. The groups have to be, like I said, law enforcement, health department. You have to have community members. It's a bunch of people. This was just an additional program that WCA was letting everybody know about. The ones that are utilizing it are the ones that are setting up programs that are above and beyond what we would ever be able to access.
Committee are successfully completed and been working on strategies into programming that potentially, if there were to be something.
Yeah, but you're committing future funds. Yeah, that would be a problem. Yeah.
Yeah, so I guess I would advocate for a ground up approach to this based upon what we want to accomplish rather than have a board or committee make the decision and then push it down. You know, understand where I'm going with this?
Mm-hmm.
It's got to make sense from an operational standpoint. And I think if you come to us and say, yeah, this is what we want to do, I would think we would probably be amenable to going forward. But I think it needs to come from ground up rather than top down.
Yeah, I think maybe what we could do is get a chance to look at this and review this.
This is mostly an FYI. This came up at an update from WCA. Nick texted me or emailed me and said, I think we should bring this to here and then go from there. So I think we'll go from there. Okay. All right. Thank you. Let's move on to aging and disability. Chris and Dawn. Chris first, I would assume. Chris, maybe.
No,
Dawn.
do the presentation.
Okay, Dawn. Oh, and Shay. Bring up.
Shay will do the presentation.
Yep, we have our dementia-friendly training dementia specialist, Shay O'Rourke.
Shane, did you figure out about how to do the?
Thank you, ladies. Are you on?
Yeah, I got it. Hold on.
No, turn the light green. Down below.
Oh, okay. How about now?
It should pick you up. There you go.
Got it.
Welcome.
All right, thank you. Okay, so what this is a state initiative. So, through the Department of Health Services of Wisconsin, the Aging and Disability Resource Center, and then more specifically, dementia care specialist, my position. So, this dementia-friendly training is available for groups, organizations, businesses throughout the communities within the county. Basically, I go through this training, and as long as 75+% of the staff at the institution attends the training, they are then certified. So they get the certification as well as the purple angel that they can put in the window or anywhere they prefer that's visible to the public. So basically what this is a PowerPoint presentation. I'm going to stick to the script so I don't take up too much time. But if you have any questions at any time, feel free to interrupt me because that's usually how I run the trainings. So, all right, so I will get started here. All right, good morning, everyone. Today we're going to be doing a dementia-friendly business training that is an initiative through our Price County Dementia Care Network. The goal of this initiative is to create dementia-friendly communities where people living with dementia can feel safe and empowered to continue to live. After the training today, you will be certified as a dementia-friendly organization, which means that everyone here understands dementia and are able to assist all of those we interact with living with dementia. Okay, today we are going to cover the definition of dementia, the 10 warning signs of Alzheimer's disease, and tips in creating a dementia-friendly environment. So let's take a look at the definition of dementia. Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. This is important to know, and this is not, it doesn't feel very known out there that dementia and Alzheimer's or a disease of dementia is different. Dementia is just a broad term, where it impacts your memory or behavior. Alzheimer's is a specific disease. Dementia, being a broad term, is reversible. So for instance, say that dementia is brought on due to alcoholism. That is reversible. But once you're diagnosed with a disease of dementia, that is not curable as of now, even though, I'm working with the Wisconsin Alzheimer's Institute based out of University of Madison. They have all kinds of initiatives and they're doing great work there. They're, amongst the top in the country, even the world, when it comes to research and, what's coming forth down there. But there is not 100% cure. There's medications to slow down the progression of a disease of dementia if you catch it early on. So I do have customers that travel all the way down to Madison, where they're seen at the Institute, and, they're currently going through, research and treatment themselves. So, they're doing wonders down there. Okay. All right, next slide. All right, Alzheimer's disease is the most common type of dementia and accounts for 60 to 80% of cases. Other types of dementia include dementia with Lewy bodies, frontotemporal, and vascular. Okay, next slide. So now we'll go through some of Alzheimer's facts. Nearly 7 million people today are living with this disease in the United States. When I go through these numbers, take into account that this is what's reported. So, this obviously doesn't account for, if it stays in the home and is never disclosed, or there is never a diagnosis. 1 in 10 people age 65 and over have Alzheimer's disease. 1/3 of people age 85 and older have Alzheimer's disease. Nearly 60% of people with dementia live in their homes and communities and need support from families and community members. 1 in 7 people with dementia live alone. There are 16.1 million caregivers working with people suffering from Alzheimer's or other forms of dementia. Older African Americans and Hispanic individuals are more likely to have Alzheimer's disease or related dementia. And somebody asked me why that is. And, kind of the abundant theory is the fact that with their culture, their eating habits can tend to be different than other cultures. On average, in northern Wisconsin counties, there are an estimated 400 individuals living with dementia. That means they are not living in a nursing home or assisted living and could very likely walk into our door looking for help. Or you are also likely to run into someone with dementia when you're at the store, at church, or any other community event. Okay, next slide. Okay, there are 10 early signs and symptoms of Alzheimer's disease. Our role as a dementia-friendly organization and as a dementia friends out in the community is not to diagnose someone with dementia, but rather to help that person more easily navigate our organization or community setting. In some cases, we may need to encourage the person to see their healthcare provider so that a professional can assess changes happening. On the screen, you will see a table with one column listing the early signs and symptoms of Alzheimer's disease and another column listing what you may notice out in the community. On the screen, we will compare warning signs to normal aging. And I handle a number of cases where one of the things that I do is perform memory screens. So I do one that's general basic. It's approximately 10 to 15 minutes. And then I do a more detailed memory screen that's called the MOCA test, and that's based out of Canada. And it's actually the same test that neurologists and neuropsychologists perform at their memory clinics. So, but a number of times I have worked with individuals where, they are concerned about forgetfulness and, even people into their early 90s, and it turns out not to be dementia. So you may notice an individual walks out of a store, gas station, or bank without grabbing their things. You may notice an individual consistently ask the same questions. Or you may have an individual who looks to their spouse to answer questions they would have answered on their own in the past. The second sign is challenges in planning or solving problems. Some people may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of monthly bills. They may have difficulty concentrating where it takes much longer to complete thoughts that didn't take long in the past. You may notice a neighbor tells you they can't make their favorite cookies because the recipe doesn't work anymore. Or you may notice an employee turns in a financial document with errors that does not seem to understand the errors. The third sign is difficulty completing familiar tasks at home, at work, or leisure. People with Alzheimer's often find it hard to complete daily familiar tasks. They may have trouble driving to a familiar location, managing a budget at work, or remembering the rules of a favorite game. You may notice a cashier isn't able to count the money in their drawer at the beginning of work and is frustrated that the way we do this has changed. You find a longtime community resident driving in circles. They explain they can't find the church and are sure they changed the street names in town. Okay, so next. The fourth sign is confusion with time or place. A person with Alzheimer's can lose track of dates, seasons, and the passage of time. They may have trouble understanding something when it is not happening right now. At times, they may forget where they are or how they got there. So you may notice an individual enters a building, is very confused about where he or she is, how they got there, and what they are supposed to do while they're there. You notice somebody starts going to or showing up at appointments on the wrong day and time. The fifth sign is trouble understanding visual images and spatial relationships. For some people, having vision problems is a sign of Alzheimer's. They may have difficulty reading, judging distance, and determining color or contrast, which may cause a problem with driving. You may notice an individual continues to have dents and dings on their vehicle. They may say something like, "The city just moved the light pole behind my garage and I can't see it correctly." Or you see that an individual frequently trips or falls. The sixth sign is new problems with words and speaking or writing. People with Alzheimer's may have trouble following or joining a conversation. They may stop in the middle of a conversation and not know how to continue, or they may repeat themselves. They may struggle with vocabulary, have problems finding the right word, or call things by the wrong name, hence calling a watch a hand clock. You may notice an individual who has always been very independent ask you to read documents for them. Or a drugstore customer points to things that he or she needs and asks for that stuff over there, while not being able to find the right words to clarify what they want, where they become frustrated. The seventh sign is misplacing things and losing the ability to retrace steps. A person with Alzheimer's disease may put things in unusual places. They may lose something and not be able to go back over their steps and find it. Sometimes they may accuse others of stealing. And that's a very common symptom. I mean, I see that in almost everybody with dementia are the accusations of stealing. I went through this with a number of my family members, including my mother, grandfather, grandpa, my great-grandma, and my great-grandma thought the gypsies were breaking into the house and stealing our stuff. So she gave us some good comedy material with that. Like throughout my childhood, though, we had some good gypsy jokes. So you may notice an individual cannot find their purse or wallet and they accuse you of stealing it. An individual fills out forms at an office, bank, or store and leaves all the paperwork behind upon leaving. Okay, next slide. Paranoia is common. I feel for the police department and the sheriff's department because of the calls that they probably take. One of the calls was just almost to a T, like stereotypical case of dementia, paranoia. An individual thought that people were coming into his house or breaking into his house, and he was very adamant about it. So almost clear, this is dementia. And the police department actually set up some cameras and found out someone was coming into the house, breaking into the house. So like it gets really hard to distinguish at times with like, what do you do in certain circumstances? Okay, the eighth sign is decreased or poor judgment. People with Alzheimer's may experience changes in judgment or decision-making. For example, they may use poor judgment when dealing with money, such as giving large amounts to telemarketers. They may pay less attention to personal grooming. You may notice a family member is consistently withdrawing money, which is out of character for them. The banks actually and credit unions do a great job of keeping their eye out for that. So they're doing everything in their power to, if they see something unusual, addressing that with one of their customers. A friend tells you that her mother gives money away to every charity that calls her. The ninth sign is withdrawal from work or social activities. A person with Alzheimer's may start to withdraw from hobbies, social activities, work projects, or sports. They may have trouble keeping up with a favorite sports team or remembering how to complete a favorite hobby. They may also avoid being social because of the changes they are experiencing. So you may notice an individual begins having trouble following along with conversations and stops showing up to any type of social gathering, or you notice that a regular stops showing up at a particular social gathering. The 10th sign is changes in mood and personality. The mood and personalities of people with Alzheimer's can change. They can become confused, suspicious, depressed, fearful, or anxious. They may easily become upset at home, work, with friends, or any place out of their comfort zone. So you may notice someone who has been easygoing seems angry much more often. Someone who has been independent for many years calls the police because they believe someone is in their house or trying to get into their house. They cry and seem very fearful. Okay, so we're going to talk about how we can effectively communicate with an individual suffering from dementia. Okay, so communication is about what we say and how we say it. The tone of voice we use and our body language become more important as a person with dementia loses the ability to understand spoken language. Use a calm voice, try not to speak loudly. Make sure you are talking to the person in a quiet environment so that they can focus on you. So an example of that is, say it's a holiday, say it's Christmas or Thanksgiving, and somebody with dementia, if they're surrounded by 10 people and there's multiple conversations going on at once, if there's 2 other conversations going on and it's an individual with dementia, it's magnified by, a lot. So you could imagine if there's a lot of conversations going on in a room and they just can't comprehend, what's actually going on. So, and I always tell customers that around the holidays. Consider your body language, how you are standing, and how you are using your arms and hands. Does your posture convey that you want to help or that you are frustrated? Approach the person from the front. The person with dementia may have a loss of peripheral vision. Oftentimes they have tunnel or binocular vision. Approaching from the front may reduce fear or prevent them from being startled. Speak clearly and be patient. Speak clearly, calm, and allow the person time to understand information. It may take a little longer for information to process for someone with dementia. They may hear the information but have trouble interpreting what they hear. Try using different words if the person is not responding. Use simple, short sentences and avoid direct questions. Keep choices to a minimum and don't raise your voice. When possible, use a quiet, non-distracting space or place to talk. It typically takes about 15 to 30 seconds for someone with dementia to hear what you say, process that, and then come up with an answer and then respond. If you actually count to 30 seconds, that's a long time. It is really, really difficult if it's an individual with dementia to wait, even 10, 15 seconds before trying to help them out, but it can take up to 30 seconds where they're actually able to process the conversation, what they heard. Listen closely, listen carefully to what the person has to say. Give plenty of encouragement as you look for clues about what they may be trying to communicate. The person may seem confused and say something that doesn't make sense to you. If the person finds it difficult to come up with a word, suggest one, but be careful not to interpret or finish their sentence. Don't rush, try to go at their pace and work through the situation as best you can. Smile warmly, make eye contact. Someone with dementia may find it difficult to understand what is being said, but may quickly interpret the look on your face, your tone of voice, and your body language. Use a friendly tone and give body cues that respect their personal space. And example I always use that, unfortunately I wasn't able to meet you guys at the hospital in Park Falls, but it was like kind of the officer's demeanor with a patient that, was at a facility and they basically sent them to the ER. And what can happen if you look confrontational, it can easily progress or escalate the way that a person with dementia feels. And, that can quickly turn into a very, difficult, dangerous situation. So watch for signs of change and offer help accordingly. Every day can be different. For some people with dementia, each day can bring a change in what they can do. How you help someone may differ each time you interact with them. Join the reality. If someone with dementia is telling you something that isn't true, maybe they're looking for someone who has passed away. Do not try to argue with them. Instead, agree with them, reassure them, and redirect them. We call this therapeutic fibbing. You are not lying. Example of therapeutic fibbing, I had a customer whose dog had passed away a couple of years prior. So half the family would continue to remind her that the dog had passed away. The other half would play along with that because she has no control over that. Her brain won't allow her to process or remember that the dog had passed away. So basically you have half the family that's putting her back in that situation where her dog has passed away. And then you have the other half that, would play along with it so she didn't have to emotionally suffer through that. So that's an example of therapeutic fibbing. Okay. So, next slide. There are little things you can do to the physical environment to make it safer and more welcoming to people living with dementia. You have the opportunity to make it easier for someone with dementia. So we're going to talk about some things you can do. So this is more for any type of building, but some of this can also be applied in a home setting. Entrances should be clearly visible and understood as an entrance. Make sure that glass doors are clearly marked. Signage for finding your way around should be clear, should use bold type, and should have contrast between the words and background. Signs should be mounted to the doors or spaces they refer to, not mounted on nearby surfaces. Signs should be at eye level and well lit. Avoid using highly stylized or abstract images or icons on signage. Think about placing signs at key decision points for someone who is trying to navigate your premises for the first time. Signs for getting to and from public restrooms are important. Okay, next slide. Lighting at entrances should be high-powered and include natural light when possible. Avoid pools of bright light and deep shadows as they appear to be holes to people with vision issues. Flooring should be plain, not shining, and not slippery. Bold patterns on carpets, curtains, or wallpaper can cause perceptual problems. Plain walls and flooring are recommended. Keep floor finishes flush. Step surfaces can cause confusion. Pathways should be wide. A family restroom or changing facility will allow someone to be assisted without causing embarrassment to them or another user. Okay, next. Quiet areas for someone who may be feeling anxious or confused can help that person recover enough to independently complete what they were doing. Seating areas in large spaces, especially areas where people are waiting, can help someone relax. If you're bringing someone or helping an individual in a setting, it's helpful to find areas with the least amount of noise and distraction. Layout of an area should be free of clutter and arranged to make it easy to move around. Okay, so this slide here, I just downloaded this because, in my opinion, everything that I just went through, certain behaviors, memory issues, I feel like it's hard to comprehend if you don't actually know what's going within the lobes of the brain. So I just wanted to go over this slide real quick. The first one, your frontal lobe, it's associated with parts of speech, planning, reasoning, problem solving, and movements. The fourth one, the temporal lobe, this region is related to perception and recognition of memory, auditory, stimuli, and speech. So you will hear the term frontotemporal dementia. That's what Bruce Willis has. So his ability to comprehend and his speech has been impacted. The second one, the parietal lobe, help in movements, the perception of stimuli and orientation. And the third one, the occipital lobe, it is related to visual processing. So if you can take that with the lobes of the brain and just imagine, basically what dementia is, it's these plaques and these tangles that attack specific areas within the lobes of your brain. So if you could imagine that a particular area is being attacked by these plaques and tangles, you're not going to have the ability to, comprehend or speak, or you're going to have memory issues. So, and that's all I have. I'm not going to go through the case study because I'd be here another 30 minutes with you guys. So I think you guys are kind of short on time. So, any questions? I know it's real upbeat. So, if you ever have any questions, feel free to reach out to me. Or if you know anybody that has any questions, or you think I could be helpful in any possible way, yeah, just please have them reach out to me. It's the best part of my job. I enjoy it. I even have customers that just call and vent. So I get to hear some really good stories. So.
Any questions?
No, just a comment, Shay, very, very informative. And as we age, we run into more people that have symptoms like you're describing, and it's helpful to know some of the clarity between here and there, you know. So thank you.
Thank you, Shay. Thank you. Okay, at this time, I'm going to have to book. I have an appointment that I need to get to, so I'm going to pass the baton over to our Vice Chair, Mr. Kopish. And I thank you all. I'm sorry I'll miss the rest of your presentations, but talk to you later. Thanks. Bye.
See you, Paula.
Yeah.
Okay, moving on, we have the Aging and Disability Quarterly Report.
Hi, everybody. So I'm just going to talk about Shay's position first, and just let you know that he currently has 34 cases that he's working on within our county, working with family caregivers, doing consultations. Go ahead, Ellen.
Shut it off.
Oh, there we go. Okay. So currently 34 people that he is working with within the county doing consultations, and they call him, he can go to the home. So he works very closely with those people and trying to help them to maneuver the different behaviors and needs of someone with dementia. So the support groups are going very well. We've been increasing membership. It seems like on all of them from month to month. So the Memory Cafe, and you'll see the support groups listed there as well. The virtual support group also seems to be catching on. We started with just 2, we're up to 4 members. So hopefully that'll keep going, and we'll get more as each month goes by. So the dementia-friendly trainings, which you just saw a very brief portion of, and I know he was really rushing through it, trying to just kind of give you a taste of it, but they are available to all of the businesses in our county, and I have also offered them to law enforcement. Just because I know they get a lot of calls, a lot of domestic calls, and oftentimes there's one or sometimes both people in the home that have dementia. So I think that could be helpful to them. So that has been offered. And then right now he's also got a powerful tools for caregiver class going on, and that is designed to help people who are caregivers in the home and give them some tools to help them to cope with that and to provide the care that their loved one needs. And then he's going to be doing memory screenings, and those will be again at the nutrition site. So we'll be starting those. I think this summer he's planning on organizing some. And we also did some outreach to the nutrition site. So Shay and then one of the ADRC specialists did speak at, I believe, 3 nutrition sites recently. So then going back to the ADRC, so I have the numbers there for the last quarter. They don't vary a whole lot. Some quarters are busier than others. But this quarter we had 63 referrals. Did 15 screens. National Family Caregiver Program right now is full with 8 people in that program. Alzheimer Family Program is not full. There's only 3, but that one is more difficult to get people because they need that diagnosis of Alzheimer's or another dementia. And there's also some income limits. Right now, the state is looking at getting rid of those requirements for that program, which would then open it up to more community members. So we have our fingers crossed, and we're hoping that that happens. So then if you look at the back, I do have the dementia or the disability benefits specialist. She has handled 36 cases right now in Price County. And so they do get a monetary impact for that, and that's 102,479 of the cases she's handled. So I did give a brief description of what monetary impact means below that. So you can see on there, those are really tax dollars that she's bringing back into the community by helping people to apply for benefits that they are entitled to. So then that money comes to them, and then there's less county funds that need to be used to support those people. So I hope that makes sense to everybody. Any questions on that? Okay. So then going to Adult Protective Services, you can see our numbers there for the first quarter of the year. We did have 2 emergency protective placements. They both took place in January. Neither one were at Clark County. They were both in hospitals for people that had very significant medical situations. And then we do have just a couple other things I added that aren't on there. So I think you all got a flyer for our speaker for World Elder Abuse Awareness Day. Yep. So that is a Judicare attorney that is coming down to present at the Phillips Nutrition site. So we're hoping to get the word out there and to get some of our community members to come and be present for that. And she's going to talk on financial scams and what we can do to prevent those. And I really do believe everyone we can prevent is really a benefit to our county, not only for the people that are losing money, but for the sheriffs of our department that's investigating all of these. It takes a lot of their time, as well as adult protective services that is involved in those investigations. So prevention, I really believe, is the key. So we just keep trying to get the word out about that. And then just the last thing to let you know that the Senior Resource Directory is finished and should be coming out on May 22nd. So you can look forward to seeing that. Any questions?
Anything? Okay, thank you.
All right.
Yeah, thank you for your report. And now we have appointments here to the Nutrition Advisory Council. I
Yeah,
think
so
we
you,
have,
you need to recommend these
yeah,
individuals.
and it's Kay Erickson to fill the Ogum Apprentice with a term to expire on 4/30/27. Looking at this report, there's a Danny Hoffman.
Yeah,
Pardon?
she's a dietitian.
Yeah,
Okay,
she's
so we
Price
don't have
County.
to do anything with that.
No.
So that automatically happens, okay, because I see 4/30/25 on here.
Yeah, that dietitian position is permanent in a sense. It's just whoever our dietitian
Yep,
is
okay.
on that.
Sounds good. So what do you need?
Motion to recommend.
Motion to
these.
recommend the appointment?
I would make that motion.
Okay, second. Okay, we got Joe and Dennis. All in favor, say aye.
Aye.
Opposed, no. Motion carries.
So those will go on a future board meeting as for the board to accept those that recommendation. of
Okay.
Appointment.
Yeah, that's what we meant.
Yeah,
Yeah,
you
okay.
recommend them.
Yeah, I know, we
go to
recommend and
next
the board
step.
has to
Yeah.
appoint. Yeah, okay. So then we have updates on the seats and terms. We got the commission on,
I kind of had put that on here because I kind of wanted everybody to see the committee members and where we're at. And so I thought first we could go with the COA, the Counseling on Aging Committee. We will see here, we have 2 terms that are ending, Mary Anderson and June Ellefson.
what about Schmidt?
He's ending, but he's on his first term, so he can get
He what?
re-upped.
Does that just happen automatically then?
We go through the process, but because they're on their first, we recommend that they do their second after asking the individual. Yes,
And he wants to do that?
we haven't.
You're gonna, but
Yeah.
obviously you ask him.
Yeah, we'll have to ask him. I don't know. We talk to him all the time,
Okay.
so I don't know where we're at with him.
Right. And so for the 2 that have expired, we've already had interest from the South and Central Price County. They do fill out a statement of interest. And I think we've probably gotten maybe about 4 or so interest to partake in the Counseling on Aging.
From the south.
And Central.
And Central.
And Central.
Central and South,
Yeah,
yeah.
but open till the end of May
End of
to
May, yep.
collect that information.
So when would we be making that recommendation?
For those, well, it goes till the end of May, so
Oh,
once we
okay.
get all of
So,
them.
so the
Right.
expiration date on these terms isn't April, it's May?
Well, they're expired.
They're
they
done.
just the committee doesn't meet until
Okay.
we'll have
Okay.
members. So
Right.
So we'll do this next month then? Okay.
And then the next one is the Nutrition Advisory Council Committee, where the 2 terms, we had Sharon Wade, who indicated that she was not interested to continue. And then we had the vacant where Kay Erickson, we just had now
Right.
recommended her. She will cover both of those spots. We had Phil Youngs, who was on the committee, but we don't need to have somebody representing home delivered meals. So.
So she resigned? Is that what she did?
Yes,
Yeah,
she
okay.
is. And,
All right.
and
And
then
then TCC?
the TCC, then, we need one position with Carissa Smith, who has, fulfilled her term, and so we are now looking for a consumer agency advocate.
And that's the north.
So,
That one doesn't have to be a
I don't think it has,
location.
no, it's
It's a-
just,
They
a
have to be an
consumer
advocate.
consumer,
Yeah.
So we can scratch the north out?
right.
They currently are from the north, so then we try to look at the other positions and go,
Oh.
oh.
So
don't
the
pick
north does
all
mean
north.
something. Yeah.
It helps us when we're not going to decline somebody if they were, Pam was also from the north or whatever.
Okay.
Like, we just, so we know to try to spread it out on the non-specific.
So that position is open and we'll be looking for somebody to replace, right?
Right.
And you got Pam Snyder highlighted? That one's automatic?
Right, she still has one more term.
Okay. And the same thing with
Dixie.
And
Friedman?
the Dixie and Marty, which Marty's not up yet, those are recommended by the city.
Okay.
Cities. So
So they will let us know.
I'm assuming the city would want Dixie to continue. She's done a nice job as a liaison.
So we'll be taking action on these next month,
Yes.
correct? Okay. Anything else on that? Okay. So we had a Nutrition Advisory Council meeting. You're going to give us an update on?
Sure.
Okay, thank you.
Hello. The meeting was held on April 24th. It was at the Phillips Nutrition site. I let the council know that we have 2 new drivers in Ogama delivering meals for Ogama Prentice Route, Lauren and Cindy Erickson. We're looking for a substitute driver for Park Falls. The driver we had hired for a backup or a sub declined after she was hired due to she wanted more hours. She didn't know it was very, very little. So we're looking for a sub driver as well as a volunteer driver for Park Falls. The Senior Farmers Market Nutrition Program begins in June this every year. We've set up distribution locations, which will be early June in Park Falls, Phillips, and Ogama. Those who qualify will get $25 this year. So last year it was $45, so it decreased this year. The total meals served in March was 1,432. In your packets, you received the home delivered meal and congregate dining surveys. I will not go through all of them. I just wanted to touch on the home delivered meal survey that was sent to 65 participants, and we received 43 of them back. When asked how the food tasted, 95% of them said it was good, very good to excellent. One of the questions, without these meals, would you still have at least one hot, freshly prepared meal to eat daily? 40% said no. Without these meals, would there be days you did not get enough to eat? 26% said yes. So I thought that was kind of interesting. On most days, is the home delivered meal driver the only person you see? 35% said yes. And then there was quite a few comments, but overall, the program is well received and people are very grateful for it. It keeps a lot of people in their homes. The congregate dining survey, we had 128 surveys sent out and 77 of them were returned. When asked how the food tasted, 90% said good, very good to excellent. Without these meals, would you have at least one hot, freshly prepared meal? 18% said no, they would not. And then there were very many comments, mostly good comments, but then you'll have a few of the not so good comments. So we look at these and then I go through the comments with the site managers to see what we can do better. Same with the caterer. And those we do every year. The sites each gave their reports. Brentwood continues to be overall, they have rarely any complaints about anything there. Same with Park Falls. Everything is good. Phillips the same, they have no issues. Kennan continues to have a lot of concerns with the meals. Bless you. Some of them, they would like more gravy, they would like more healthy food choices, more salads, things of that matter. Ogama had a couple concerns, otherwise it was all good. Phillips was requesting additional drivers to help deliver meals because Marlis has been delivering meals. So we continue to try and advertise for that, but with no luck. And the date of the next meeting is July 31st, and that'll be in Kennan. Any questions?
Yeah, just to follow up, you're looking for a substitute driver in Park Falls?
Yeah.
We had the one and they quit, so now we're looking for another one?
For Margaret, yeah.
Yeah, and then you're looking for a volunteer? What is that?
What I'd like to do, it's just a volunteer position to take over Dawn's route
Oh, okay,
and maybe do the 5-field route,
okay.
to make the route worthwhile for somebody to do, just to get mileage reimbursement. Right now, our numbers continue to grow for home delivered, like quite a bit.
Yeah.
So I've just put 5 new ones on Margaret's route. So it's getting to be a lot.
And Margaret's good, right?
She is.
Good,
Yeah.
good. Yeah, I know she does a good job. And
Yeah.
we have Nancy as a substitute
Yes.
for Dawn.
Yes.
And
been
she's
working
okay
out
too.
really
Yeah,
well.
she's really
Yeah,
doing well. Yeah,
Dawn said she picked up just like that, and
Yeah.
very happy with her.
yeah. Oh, that's good.
Yep.
Okay, thank you. Anything else? Any questions, anybody? Are you done? No? You got more? Okay, we'll keep going.
I have the quarterly report.
Oh, I thought we got that. Okay, go for it.
Okay. So, January, February, and March numbers, 66 people received home delivered meals in those 3 months. 158 people dined at the congregate meal sites. The total meals served was 4,120. We average approximately 90 meals per day. I already touched on the senior farmers market. We get 117 booklets in for Price County. Transportation program, that's the elderly and disabled program. Our volunteer drivers drove 4,961 miles and volunteered 154 hours of their time. The community outreach program coordinator, Strong Bodies, she touched on that. Spring session began in March. all the sites are operating well. There is now a new leader that has been trained. She's going to offer a class this summer for as a new option. I think it's like at 5 o'clock or 6 o'clock in the evening. So so that'll be nice. She is inquiring about moving the Phillips classes to the First Presbyterian Church for more space. We're running out of room at the normal building, but that's still being looked into. The Pleasant View Memorial Fund, Cheyenne has 2 Price County residents currently being served out of that program. One is receiving personal care assistance, the other receiving medication management. Under health promotion, the Eat Smart, Move More, Weigh Less classes have ended. The class was well received, so we'll probably purchase more vouchers or spaces with those. She is registered to take Mind Over Matter training. That's a bowel and bladder training for women. Senior nutrition site programming. January, there is bingo in Phillips and Brantwood with 11 participants. February, APS, Adult Protective Service presentations were at all sites. March, there was bingo in Park Falls and SCAMS presentation in Phillips with Indigo presentation in Ogama with 0 attending. I touched on the Valentine's Day last time. Senior Fair. So we are working with Dawn with the ADRC to put together a senior living expo. That'll be October 14th, I believe. So that'll be over at the Armory where Cheyenne's doing a lot of work for that, getting a lot of vendors and speakers lined up. There'll be Red Higgins, I believe is his name, and we'll have food, and it's sponsored by Aspirus. So she's been continuing with Teen Court and along with Triple P, which is a program she works with through Hayward. Any questions?
Okay. Thank you. So based upon the absence of some of these people, Sarah, are you taking over? Okay, go for it.
All right, so for children and youth, the quarterly report. I think you guys are all pretty familiar with this quarterly report. As you can see now in 2025, our cases are going up. A lot of them are drug related. At this time, there's 24 children in out-of-home care. We have 13 that are out of county, and then we have 11 that are in county. On the next page is the cost, and it kind of shows where we're at with the difference between the subsidized guardianship from court-ordered placements, local treatment, group home, and what the costs are for those placements for this quarter. And then on the last page is the Price County annual placement costs, in which you see that we're at, right now, we're at $177,366 for out-of-home care. So I wish we could control it, but unfortunately, right now, placements are going up.
Well, that one for 17,000 is in here, right?
Yes.
Yeah, so
Yeah.
that's,
I know,
what do you do?
exactly.
Yeah.
So that's for the children and youth unit.
Okay,
Behavioral health. Again, there's no changes in regards to this reporting system. I don't know if anybody has questions in regards to it, this, but I can let you look this over. Um, I know on the very last page, I'd like to still bring that up as that children's waiver is, we have 53 cases, which is a large caseload for children's waiver. And that's one person that has that caseload. So, hopefully that she can continue. Right now, we can't disperse it in that unit. Having another CLTS, and we cannot put them on a waiting list. The state has indicated there is no waiting list for CLTS cases. So, and that's the cases that go from children's waiver from 0 all the way up to 21. They don't go off the program unless the family asks their request.
How are these numbers compared to last year's numbers? Are these up?
Children's waivers going up,
Yeah.
yes.
And we have the one person, you said.
It's the one person that does.
That's a lot of, yeah.
It is a lot of cases because there's a lot of requirements in regards to that she has to report to the state on.
Back on that behavioral health, are those numbers consistent with last year?
Some have fluctuated. I can't tell you right now exactly, but on the CCS program, that is going up, and quite considerable. So,
And when they're on CCS, that's covered by the state, right? That's state funding.
right,
Which that's why you see on behavioral health, the cost this year has gone down about 25% compared to last year, but doesn't mean the cases are going down because there's a different funding.
Okay.
So,
all right. Thanks.
okay.
Okay, unless anybody has any questions, keep going.
Okay, economic support. All right, economic support. I know we really never had, I mean, now this is probably the second time that we have had a quarterly report, but I just think it's so important for you guys to see the numbers. So on the left side of the,
Yeah, this one?
yes.
Yeah, okay.
On the left side of the graph is just Price County residents and the cases that are in Price County. On the right side is for the consortium, for the total consortium. So kind of just to think about it, the total calls on the right side is 8,000. Some calls, total calls received per week are about 2,000 calls, and that's throughout the consortium. So some of our workers could be dealing with Wood County. Wood County workers could be dealing with Price County. But I thought you'd like to see, I'm not going to read through all of this, but you can see the difference and the amount of cases that are in Price County.
And this is how many counties?
5.
5?
5.
And they are which?
You would ask me that.
Yeah, well,
I know that. Why'd you have to throw
I'm
me
looking
in
for
a-
if they're small counties or big counties or,
What is the largest county?
okay.
So.
And price?
Yes, I'm trying to think here, because I don't want to get, who's it? Ashley might be our ADR.
that's the problem. One is ADRC.
Even one is, I know now, they don't have it with me.
Okay.
I will email it to you.
Are we the smallest county?
She's gonna look it up. Wait a sec. Yeah, I know, that's the, because we have 2 consortiums going, so might mix counties. Yeah.
My computer is slower than me. Yes.
Taylor's in there. I'm trying to recognize. Taylor. Oh. Clark's not in there. Yeah, I know it's a long, I'm trying to think, yeah, Taylor. I know.
Tell us. So keep going, Sarah.
Oh, Carrie's next.
Wait.
Bayfield, Ashland, Iron, Violet,
Forrest, Florence,
Oh,
Sawyer,
there's-
Price, Rusk, Taylor. and
Oh my
Lincoln.
God, there's.
Oh, there's a whole
that's
pile of them.
6, and then it's the other one
Okay,
that's
all right.
ADRC, that's the
Yeah,
smaller
that
one.
It's the 5.
Yeah,
Okay.
Yes, you're correct, Sarah.
thank you. All right. and
All right,
then
thank
say
you.
the Carrie's up next.
It's a good lead in then.
Okay, so you have that same report. Kind of the trend that we've been discussing throughout this whole meeting is CNY out of home placements. That cost is also reflected here on that report where you can see that increase. As far as the AODA and behavioral health, that one is too also unpredictable. We're just a little lower than last year so far, but still on the higher end of things. Any questions?
Actually, in both of them versus budget, we're ahead of where we should be on a percentage basis as far as the amount of cost, right? We got 180,000 versus 600, so that's over a quarter, and we got 120,000 versus 286, so that's over a quarter. So both areas were on a trajectory to be over budget. So, but again, what do? Right?
You just keep trying.
Right,
It is
and the
what
ni-
it is.
The nice thing with, not the nice thing, the with that, so we did lower the budget going into this year for those because the last 4 years has been pretty good. But that also, because we were a higher budget for the last 4 years, we've created a healthy health and human services fund balance.
Yeah, we have a fund balance.
So again, we don't want to eat into it, but that's what it was there. We got to a point where we were just putting too much in. It's not right to just stockpile. So now we're rebalancing that, but it causes issues for future funding.
Yeah, okay. Any questions? Thanks, Gary. Back to you, Sarah.
Okay, for the director's report, for 2024, Carrie and Chris had applied for, because it's called REAB-DEOB, in regards to other counties not being able to utilize all their funding. So for the congregate, they received, they applied and we received $46,199. So that was pretty awesome. And then we also got another $3,000 for elder abuse. So that was awesome for those guys. Like you heard from the Sport and Home Show, was very successful throughout all the units that were there, from behavioral health to foster care, public health, the ADRC. And I was there too, and they had, Saturday it was packed there, and they had a lot of people stop at the booth, which was where we were thinking we might need one more section just to be able to have more information out there. Just wanted to let you know that this month is Economic Support Month. And also this month is Foster Care Month. So the Children and Youth Unit will be doing some stuff for the foster parents. And next month is the World Elder Abuse Awareness, which you had received a poster from Dawn. In April, Chris had a banquet for volunteer drivers. We had a great turnout. And one of the recognitions was Lauren Nelson. He has driven for 20 years. So that was pretty cool. And that was held at Marie's on Fayette. Then the next part with personnel updates, we have three positions that have opened up. One from Family Skills, our gift coordinator, and then also our admin position. The two that we are going to advertise right away will be the Family Skills and also the admin position. The gift program right now, because we get 33,000, but with all the amount of cost for having that gift, we're going to see if we can utilize that money another way, using it the same, for children and youth. But so we're going to hold off a little bit on that, because we're also using for that gift program for services for families. It's not just for that position. So
What is the closing date for those applications?
They are just open, so.
Oh, okay.
Yeah, so the admin, I don't even know if we have it out yet.
Yeah, the admin one, we didn't even talk about at admin committee that it's a recruitment, but that'll go out this week, so it's usually 2 to 3 weeks.
Okay.
Are there any positions other than these that are still open that we have been recruiting for and haven't succeeded, or is this it?
We're not recruiting. We still have an open position for a social worker in the children and youth unit, but due to the amount of new workers in there, we kind of just are holding off right now a little bit until we get, yes.
Okay, so you still have one position open
Still have
there?
one position that's.
Okay. Anything else?
That's
Okay,
it.
well, I guess we're done with our agenda. So the next meeting is scheduled for June 11th. And with that, I will adjourn the meeting. Thank you all.